Hi, I'll start with what's going well for me in online clinical. I've been feeling more confident in delegating in online clinical activities. I feel like I'm getting better at recognizing what needs to be delegated to which staff members. The online clinical activities have helped me tie together advocating for the patient, critical thinking, and safety in a very real way. For my reflection, I want to talk about a situation during clinicals in October when I had to use clear nursing judgment. I was caring for a 61-year-old female with multiple sclerosis who was admitted for cellulitis of an unstageable sacral pressure injury. She had significant mobility limitations, including a contracted left arm and no movement in either lower extremity. She underwent a surgical debridement of the sacral wound, and a few hours later, we noticed her dressing was bleeding through. 2 hours post-operatively, her sacral bandage was visibly saturated, so we reinforced it as ordered. An hour after that, she was still oozing blood. Her vitals were being taken every 4 hours, and although she was hemodynamically stable, the bleeding wasn't slowing down. At that point, I reassessed the wound and considered her risk factors and let the facility nurse know, who then contacted the surgical PA. The PA returned to the room, removed the saturated dressing, and used silver nitrate to cauterize the areas that were still bleeding. A new dressing was placed, and afterward, the patient remained stable with no additional oozing. The outcome was good, but without timely communication, it could have progressed to a larger post-operative complication. Emotionally, I felt concerned at first because she was such a vulnerable patient. With her limited mobility and existing wound, additional blood loss or delayed healing could have easily set her back. Once the situation was under control, I felt relieved and also proud that I recognized the change early. Experiences like this make me feel more confident in my nursing judgment and motivate me to keep going. When I look back, I think the situation went well, but there was still room for improvement. I could have increased the frequency of her vital signs while the bleeding was active, or asked for guidance sooner about whether further reinforcement was appropriate. I also could have looped in the facility nurse earlier just to support decision-making and help prepare the room for the PA. As for why it happened, I think the bleeding simply required more hemostasis than the initial dressing could provide. Recognizing that the pattern wasn't improving made all the difference. Something I did that mattered was not ignoring the increase in bleeding. Instead, I reassessed promptly and communicated early with the facility nurse and my instructor. Moving forward, this experience will influence my practice by reminding me to pause, reassess, and escalate concerns early rather than waiting. The skills I want to continue strengthening include early recognition of complications, clear communication with the care team, and anticipating what might be needed next. Putting this into practice has already helped me grow. It reinforced that patient care depends on the attention to detail and timely interventions. It has helped me make me a better nurse by strengthening my confidence and reinforcing the importance of advocacy. I also want to acknowledge the PA who responded quickly and managed the bleeding so effectively. Their teamwork really supported both me and the patient that day, which was much appreciated. Thank you for listening.